We often get asked about the different types of equipment, aids, and adaptations that can make activities of daily living a little easier for people who would like to remain as independent as they can within their home. Sometimes equipment can be used as a way to compensate for a loss of functional ability, such as fine motor skills and dexterity, though equipment can also be used as a means of energy conservation, for example, in being able to sit down whilst washing yourself. So we're here today to give you a brief overview of some common types of equipment, aids, and adaptations that are available to help you. Please note that this video is for information purposes only and is not a guide for purchasing your own equipment, aids, or adaptations. We would always recommend that you speak to an occupational therapist, physiotherapist, or other healthcare professional for advice first. Before we start, you may be wondering what exactly is the difference between equipment, an aid, or an adaptation. Well, there is no right or wrong way to describe them, but to give you a better idea, a piece of equipment is something that is usually portable and can be picked up. Equipment tends to fall into categories of minor, complex, or for mobility. Some equipment can be funded for you to use free of charge for the time that you need it, depending upon an assessment of need from a healthcare professional such as an occupational therapist or physiotherapist. They may wish to observe how you move and complete your daily activities so they can assess whether equipment is appropriate and will meet your needs. Sometimes you may not receive the equipment you expect and you might be offered something else. When you no longer need the equipment, it should be returned to the local equipment provider. Aids usually refer to a small gadget that can help with activities of daily living. However, some people may also refer to equipment as an aid. Some aids can be funded for you to use free of charge for the time that you need it, depending on an assessment of need. However, there are lots of aids and gadgets that are not funded, and you will need to purchase these. You can find suppliers online through an internet search engine. If you don't have access to the internet and you would like some advice, you can speak to your healthcare team. An adaptation is usually fixed and can't be picked up. Some adaptations can be funded by your local authority under the Disabled Facilities Grant, depending upon an assessment of need from an occupational therapist who may be working within the local authority, community or hospital-based therapy teams, or here at St Catherine's Hospice. Smaller adaptations, such as grab handles, can sometimes be obtained through smaller borough councils, and you may be able to request these yourself in addition to the routes mentioned above. Now, let's take a look at equipment, aids, and adaptations to help with washing. Some people find it helpful to sit down whilst washing due to symptoms such as pain, breathlessness, fatigue, or muscle weakness. Some may require back support for something to lean upon. Here are some examples of equipment that can help someone to use their bath when they may have difficulty stepping in and out of it. Sometimes an aid can help people experiencing difficulty with their hands or being able to bend and reach. Many people choose to have an adaptation fitted into their bathroom, such as a grab handle or a full wet room, which is sometimes referred to as a level access shower. Now, let's take a look at equipment, aids, and adaptations to help with going to the toilet. It's very common for people to have a low toilet that is difficult to stand up from due to its height. A raised toilet seat or frame can assist when standing up or sitting down from a low toilet seat. It is also common to experience urgency, frequency, or a mobility difficulty, so it can always help to have something nearby. A bottom wiper is a portable aid that can help someone with difficulty reaching back to maintain their independence with their personal hygiene. Specialist equipment such as an automatic wash and dry toilet can help maintain dignity for people with reduced movement in their upper limbs. A tilting space option can also help people experiencing difficulty with their upright sitting posture to use the toilet. Now, let's take a look at equipment and aids to help you reposition in bed or get in and out of bed. Many people find a bed stick or bed rail a very useful piece of equipment. Furniture raisers can increase bed height to make it easier to get in and out of certain types of bed. A blanket cradle can be used to stop duvets and blankets from coming into direct contact with the skin, and this may help people with increased pain and sensitivity or skin wounds. A leg lifter can help someone to move their legs in and out of bed. A backrest can relieve symptoms such as breathlessness and pain, or improve comfort and the ability to engage with activities such as eating and drinking, reading, or watching the TV. Pressure relief is available to those at risk of developing a skin sore, which can be caused by low body weight or staying in bed for long periods of time. Some people may find a profiling bed very useful, either as they become less mobile or to maintain their independence and comfort. There are different types of pressure relieving mattress that all can be prescribed depending upon an assessment of need, usually done by a nurse or an occupational therapist. Here are some common aids that people often use when getting dressed, when they experience difficulty with reaching or bending down. Next up, here's some equipment, aids and adaptations to help you in the kitchen. Here are a few examples of some aids to improve independence and safety when preparing meals and drinks. Next, we have a few examples of some aids that can help with eating and drinking. There are also specialist pieces of eating and drinking equipment that can be assessed for people with more complex needs. Now, let's take a look at equipment to help you in your lounge or living room. Chair raisers can help someone to get up and down from a low chair. Some people use a footrest to help with lower limb swelling or general comfort. There are also different types of pressure cushion available to reduce the risk of developing a pressure sore for people who may spend prolonged periods of time sitting. Generally, chairs are not usually funded unless the person has a complex need such as a neurological condition. However, we can advise on the most suitable types of chair for people who would like to purchase them to assist with sitting and standing and other home comfort. Here are a few examples of mobility equipment that can help you to move around. These are usually prescribed by a physiotherapist or an occupational therapist. Here are some examples of equipment that can help someone experiencing difficulty with their transfers, or in other words, their ability to sit and stand up to move from one place to another, such as bed to their chair. Let's now take a look at some different types of wheelchair that are sometimes available through your local wheelchair service. You can request a referral through your GP or other healthcare professional. You may also benefit from an occupational therapy or physiotherapy assessment of your home access when thinking about wheelchair use. Here are some examples of more complex equipment and adaptations that can be used to move a person who is unable to weight bear. Now, let's take a look at some adaptations to help you get up and down steps and stairs. Next up, here are some adaptations to help you get in and out of your property. Here are some examples of different types of ramped access that may be available to you. Now, let's take a look at equipment and aids to help you getting from A to B in the community. Lastly, let's take a look at some aids to improve your personal safety at home. So, just to recap today's video, some equipment, aids and adaptations can be funded for you to use free of charge for the time that you need it, but this will depend upon an assessment of need from a healthcare professional. You can speak to your GP, community therapy team, nursing team or specialist palliative care team here at St Catherine's Hospice for more information or to request a referral to see an occupational therapist or physiotherapist. For information about home adaptations, you can contact your local authority or borough council. Please keep a lookout for the Self-Care series, which will provide basic practical information and guidance in managing everyday tasks that some people with a life-limiting condition may experience difficulty with. Our aim is to help people improve their quality of life, overall well-being and independence, and we hope that the Self-Care series will benefit those who may not require specialist input just yet or who may be waiting for an assessment, either from ourselves or another organisation. If you would like further information about any of the services available at St Catherine's Hospice, please visit our website at www.stcatharines.org.uk. If you feel that you or someone you care for is needing specialist advice, please contact us by telephone on 01723 351 421.